Hello, everyone. My name is Samantha Staba, and my IRB proposal is on vitamin D supplementation and injury prevention in female gymnasts. So to give some background on vitamin D is a fat-soluble vitamin that is synthesized either through exposure to UV light or through the food that we eat, either fortified foods or some natural sources. Vitamin D in particular modulates calcium absorption, cell growth, and neuromuscular function. So these processes are very important in athletes, considering there's a lot more stress on the body just due to the nature of physical activity. So athletes who are vitamin D deficient could be at greater risk for stress fractures and suboptimal muscle function. And the risk could even be greater for indoor athletes because they are not exposed to the sun. So the overall purpose of the proposed study is to determine if vitamin D supplementation will help to prevent injury among female elite gymnasts in comparison to a placebo group. So in terms of the current research, it's really important to understand the injury risk that gymnasts are at before diving into vitamin D and its specific effects on muscles, bones, and injuries in athletes. So gymnastics has one of the highest injury rates, both men and women, but actually women's gymnastics has a higher injury rate than men's gymnastics. And females are more likely to injure their lower limbs, and strains, sprains, non-specific pain, fractures, and lumbosacral soft tissue defects are the most common injuries seen in female gymnasts. So with vitamin D and musculoskeletal health in athletes, calcium modulation is going to be something that really affects musculoskeletal health. And there are vitamin D receptors for the active form of vitamin D found all over the body, including skeletal muscle. And calcium is a very important modulator of skeletal muscle function, and vitamin D aids in calcium absorption. So this means that vitamin D could affect muscle function and muscle contractility through calcium-related protein function and total body calcium levels. So also vitamin D, independent of calcium, enhances transcription of other proteins related to muscle function. So it's really important that athletes are at optimal levels of vitamin D, or else there could be injury. And vitamin D supplementation has also been shown to increase the number of vitamin D receptors in the muscles, improve muscular performance, and lower the risk of bone fractures. And in a 4-month supplementation study, it was shown that there was an increased isometric force and vertical jump height in female dance competitors, which is a sport that parallels gymnastics. It's very similar. Even though there's some conflicting evidence with vitamin D and increasing muscular strength, we do know that vitamin D contributes to muscle function because it regulates mitochondrial function, cell differentiation and cell proliferation, and enzymatic function. So it's very possible that vitamin D can have this effect on muscles. So any weight-bearing activity moves osseous bone tissue and stimulates the activation of bone cells. And this is really important for the health of bones and contributes to bone mineral density. And gymnastics usually produces higher bone mineral density in the athletes just because it is a weight-bearing sport. However, due to dietary issues, sometimes this isn't the case for all gymnasts. And in a study of 18 female gymnasts aged 10 to 17 years, 15 of them were found to have vitamin D levels below the recommended guidelines for optimal bone health, which is a problem because if bone health is not up to par, injuries may occur. And in terms of deficiency and supplementation in athletes, It has been shown that the levels of deficiency in various groups of athletes are comparable to those of the general population. And vitamin D deficiency is a worldwide problem. Also, supplementation does seem to be the answer to combat deficiency in athletes, but micronutrient requirements will depend on the duration of training and intensity and the type of training for athletes. So that's something important to note going into the study proposal. So for the proposed study, the hypothesis is that vitamin D supplementation in female elite gymnasts will prevent bone and muscle injuries over the course of 1 year. The primary research question is, does vitamin D supplementation in those that are deficient lead to less bone and muscle injuries in elite female gymnasts? And the main study objectives are to determine if there is a correlation between supplementation and injury in gymnasts that are deficient, to determine the correct amount of vitamin D needed to maintain musculoskeletal and bone health and optimize athletic performance for these gymnasts, and to determine if 1 year is even enough time for vitamin D supplementation to take effect. So the study population that will be researched are healthy yet vitamin D deficient female gymnasts from Houston and San Antonio, Texas. Qualifying participants are required to be between the ages of 15 and 25, and again, be vitamin D deficient or suboptimal, and are in vigorous gymnastics training, which means at least 10 hours a week. For the research setting, they will be at research facilities at Rice University in Houston and at University of Texas in San Antonio. It's expected that there is going to be about 120 participants. In terms of methods and procedures, recruitment will happen through flyers at gym facilities, and volunteers will be provided with a brief description of the study and a screening questionnaire to determine if they're eligible. If they are eligible, then an appointment will be set up with the primary investigator, and at this appointment, informed consent will be addressed, and also any questions, comments, concerns will be addressed in this appointment. Then there will be a follow-up appointment for blood draw, and if the blood test comes back that the gymnast is at normal levels of vitamin D, they will be dismissed from the study. If they are deficient or suboptimal, they will be split into 2 groups, as this is a randomized controlled trial. And so one group will be the control group and will receive a placebo, and then the other group will be treated. And if they are deficient, there will be a loading dose of 50,000 IU of vitamin D3 once weekly, until optimization. And once optimized, 1,600 IU of vitamin D3 once daily will be prescribed. For those in the suboptimal population, they will just receive a prescription of 1,600 IU of vitamin D3 once daily. Then there will be a 6-month follow-up interview with the participants. And here will, in these follow-ups, will be discussed injuries, how they're feeling. And then the same thing will happen 1 year after optimization. Gymnasts will be required to wear a UVB tracker to track sun exposure, and they will be in charge of recording that data. Weekly phone calls will occur just to make sure that the participants are reacting well to treatment. For data confidentiality, hard copies will be locked up, and all other data will be stored digitally and will be password protected. Consent forms will be provided at the first appointment with the principal investigator, and participants will be able to leave the study at any time. And obviously the main risk here is continued deficiency for those in the control group. However, At the end of the study, they will be informed that they are vitamin D deficient and they will be treated. So the main benefit of this study is optimization of vitamin D status, whether in the control group or in the treatment group. And obviously there will be a contribution to science. So for data analysis, there will be an independent 2-sample t-test. And this will be to determine if there's a significant difference in injury amount between both groups and if vitamin D supplementation has any effect on bone and muscle injury in female gymnasts. The expected results are that there will be a significant difference in injury amount between the two groups, and the placebo group will experience more injuries. And the idea behind this is that muscle strength will increase with proper amount of vitamin D, and then therefore the skeletal system will have more support and less injuries. So overall, this study is really important to conduct because indoor athletes could be at higher risk for vitamin D deficiency, considering training and competitions happen out of the sun. And for gymnasts, it's really important that this study be done just because they are at greater risk for injury due to the nature of the sport, and also at a greater risk for deficiency because they are out of the sun, and disordered eating is a lot more common within this sport. So it's really important that gymnasts are protected from these traumatizing and debilitating injuries as much as possible. And again, even for those in the control group, contribution will be worth it because this needs to be done in this sport. So this study particularly focuses on female gymnasts, which is a group of athletes that are not commonly studied. And it's necessary that vitamin D is studied within this population because they naturally don't get enough sunlight. Also, this study may spark awareness in the gymnastics community about proper nutrition and supplementation, and will also contribute to the general vitamin D research and show that it is an important vitamin for all populations and, of course, all sports as well. However, in this study, there is limited amount of control over other circumstances that could cause injuries, such as faulty equipment or even poor coaching. So that's just something to keep in mind. But it's still important nonetheless. And in future studies, injury recovery and vitamin D status would be something that would be really interesting, and especially in boxers, because training for boxers, training and competition for boxers occurs indoors as well. But unlike gymnastics, injury is naturally a part of the sport of boxing, and it can't really be avoided. So this would be a great way to put vitamin D to the test as to whether or not it helps with injury recovery and overall performance. But with this study and future research, a greater impact will be made on athletes and the general population in combating vitamin D deficiency, and hopefully more discoveries will be made on the protective effects of vitamin D. These are my references, and I just want to thank you for watching, and I hope that it was insightful. Thank you.